Welcome to Follow South Jersey's Follow Salem podcast about the people, places, and all things good in Salem, New Jersey. Today our guest is Paul DiLorenzo. Paul is the Executive Director of the Salem Health and Wellness Foundation that supports nonprofit organizations for community health-related initiatives. Since the foundation began in 2002, it has awarded nearly $59 million in grants. Hi, I'm Dean Johnson, Editor-in-Chief of Follow South Jersey, and welcome to the Follow Salem podcast. Today we have with us Paul DiLorenzo. He's the Executive Director of the Salem Health and Wellness Foundation. Hi, Paul.
Good to be here. Thanks for inviting me.
Yeah, thank you for being here with us. So, Paul, let's start off. Tell us a little bit about your background and how you came to work with the Salem Health and Wellness Foundation.
Sure. Well, I've spent about 40 plus years working mostly in child welfare, child protection programs in the Philly area, but also around the country. And those jobs have evolved over the years. I started as a caseworker in Philadelphia, but then eventually became an agency director. I worked in state government and city government both, and then spent a number of years working at a national foundation. And it was after my tenure at the National Foundation, Casey Family Programs, I left there in December of 2019 and continued to do some consulting work and was working on my own. And then the opportunity to lead the foundation came along, and I said, yes, this looks like an exciting and challenging opportunity for me.
You mentioned the Casey Family Programs. Can you tell us what that is?
Sure. Casey Family Programs is the largest foundation in the country devoted solely to the improvement of the child welfare system in this country. And they have a 50-state strategy, so they're spread out all over the place. My job was as a senior director for strategic consulting, and gave me an opportunity to work with a number of jurisdictions and all over the country.
Mm-hmm. So over the past 40 years, you've worked with several sort of organizations, Philadelphia Children's Alliance, Child Welfare Capacity Building Collaborative, Center for the States, and other organizations. What has made these causes so important to you?
You know, a couple things. When I started my career, it was really kind of oriented towards a choice that would be, I guess, more social justice in nature. Mm-hmm. I actually wanted to be a journalist when I started my undergraduate work, and then I was concerned that I wouldn't find the right niche for myself, and so decided that I would do something else where I could make a contribution. And one of my colleagues talked me into going to social work school, and so after my undergrad work, I went to get my MSW at Temple, right, and then later got a master's degree in law and social policy at Bryn Mawr College. But I think the primary motivation was to in some ways make a contribution. Mm-hmm. I'm kind of a boomer generation guy, and that was a prevailing theme in our lives. How could we make a difference?
Where does that theme come from? Were you raised with that theme? Was there an event that made you go, oh?
Yeah, that's a good question. My mom always referred to herself as a Roosevelt liberal, and my dad not so much, but he supported and encouraged us. And then my two siblings both chose professions where they were in service. I had a brother my older brother, who's now since passed, was a priest, and a sister who also was a social worker. Mm-hmm. So I guess we had it in our DNA to be bleeding hearts.
Right. So how was the transition from a social worker or caseworker to working with philanthropic organizations and leading them?
Well, it was a natural choice and an evolution. I enjoyed my work in direct service with families, but I think as time went on, I had the opportunity to lead a nonprofit agency, a large one, and then working in state government and city government, I began to see the potential for broader change, that I could be a part of addressing systemic issues, not just those daily problems that families were encountering, and to get to some of the kind of larger opportunities that were in front of me.
It's making a greater impact.
Yeah. And so going, in government and at Casey Family Programs and now at the Salem Health and Wellness Foundation, you can make a decision today that has an impact literally on hundreds, maybe thousands of lives. It doesn't happen overnight. It's a slow, gradual process, and you have to deal with the bureaucratic obstacles sometimes, but in the end, you really do have that broader reach, and that's what attracted me to it.
Right. So you mentioned the Salem Health and Wellness Foundation. Tell us about the work that the foundation does.
Foundation is a 23-year-old organization. It was spun off from the sale of Salem, what was then Salem Medical Center. And when the hospital, one of the many times it was bought and sold, had been purchased by a for-profit organization. So going from a nonprofit to a for-profit status moved its endowment into an independent foundation.
Mm-hmm.
The foundation was set up essentially to improve the health, safety, and well-being of people who live in Salem County.
Right.
And that endowment has persisted over the years and grown, which is good. But there are a variety of projects that we fund that aren't necessarily things that you think of directly as health or well-being. Perhaps they're a little off the mark from what a hospital would do, but we get to address what we look to the social determinants of health,
right,
as our primary model.
What were some of the more impactful projects that you think of from the foundation?
I've been at the foundation for about 2.5 years. Prior to that, my predecessor, there were a wide variety of things related to the improvement of physical activity among Salem residents, mental health projects, teen pregnancy projects, Meals on Wheels. You name it. Anything that kind of is considered health and well-being
right.
was funded by the foundation. Now, at one time, the foundation had a much larger endowment than it does now. And at that point, they were even able to fund building and equipment, things like that, capital expenditures.
Mm-hmm.
Our endowment has, in the last couple of years, 2, 3, 4, 5 years, I guess, shrunk because of a major investment that we made to keep the local hospital open. But that's kind of meant that we've had to realign some of our priorities. So we've become much more targeted and focused on the way that we fund and support programs in the community.
Mm-hmm. So on the Salem Health and Wellness website, it states the foundation seeks to invest in nonprofit organizations providing service to Salem County that promote health and wellness as defined by the social determinants of health. Can you explain what that means? What are social determinants?
Well, this is really in many ways the backbone of our work. Most people understand, although they don't think about it a lot, but they do understand that there are a variety of factors that influence our health, safety, and well-being. Anything from poverty, housing, food insecurity, those kinds of things can have an impact on
mm-hmm.
people's health and well-being. Not just kind of the idea of medicine, right, and giving people a prescription or something like that, but all of those factors that we encounter each day that can bring stress to a family, right? Mm-hmm. And that can also wear on their ability to live a long, healthy, productive life.
Can you give me like an example that would show the difference between like an individual behavior that affects health and a social determinant?
Sure. Well, I can remember years ago working on a project when I was in city government where in Philadelphia, where there was a significant amount of lead paint in mm-hmm. houses.
Okay.
And so in a number of the low-income rental properties, kids were being impacted by that. So it's an environmental factor. It's one that many people understand and know the implications of it, but many don't. And so as a health department, as a public health department, the city created a whole effort to kind of clean those properties out, mm-hmm. make sure that those kids and families could move back into those properties, and then reduce and lower the amount of impact that, the side effects, if you will,
right.
Of lead poisoning. So, housing that has lead paint is a great example of an environmental factor influencing somebody. The stress that comes along with, not having a job, unemployment, poverty, some of the bad choices that people are forced to make when they don't have the options for reasonably priced, healthy foods.
So they contribute to health disparities.
Health disparities for sure. And clearly poverty and race are two things that play into that.
And you're seeing that here in Salem County. It's a very diverse.
Yeah, I mean, I think if you look at the health and well-being outcomes for Salem County, unfortunately, this county is almost always close to the bottom of health and well-being outcomes. If you look at the state,
Right.
That could be anything from, the care and the health and well-being of children, to pregnant moms, senior citizens, etc. And obviously, poverty plays a big role in all of that.
Right. So in your view, what are some key challenges and key opportunities here in Salem when we're dealing with health and wellness?
One of the things I've really enjoyed about being here in Salem is that people always like to start with the opportunities, and they always remind me of that, which is great because there are many here. One of the things I think that's a real strength here in Salem County is that people know each other, right? There's less than 6 degrees of separation between and among people. Everyone seems to have gone to the prom with one another, or
Right.
they've dated each other, or they're friends, or they're in the same Rotary Club together. But there's clearly a connection, and that adds to that kind of social coherence of the county. The second thing is that a second opportunity, I think, is there's a strong faith community here, and the churches, even though COVID has cut into their to their congregation size, there's still a lot happening at that kind of faith community level. Just here in Salem City, for example, I mean, you have just everyday heroes like Sunita Johnson and Pastor Jones out in Mount Zion. I mean, these are really wonderful people doing great things. But that's an opportunity to build on.
Right.
You have some great history here, right? You drive up and down the streets of Salem City. There's these old properties that are literally a couple of centuries old, and so how do we build on that history? Create some additional tourism opportunities, which I know the county's working on. So there are many strengths, and I think we try to build on those. Nonetheless, there are lots of challenges. Generational poverty and generational trauma, I think, in my mind, rise to the top of that list. And so you have families who have been in many ways stuck in a pattern of poor health and poor well-being, in large part because of poverty, sometimes because of race. And I think we're trying to address those as best we can. Other challenges include the lack of transportation that's coherent and reliable, that covers the whole county. And then I think the other issue is just the kind of dispersed nature of the communities here, right? So people are kind of spread out. And then finally, if you think about things like prenatal care, or having a birthing hospital here, or having more than just a couple of pediatricians, et cetera, one of the challenges is you don't have enough people to make all that happen, right? So I think anybody in their right mind would look at Salem and say, we need to have more of this, more of that, especially issues related to health and well-being. But when you're talking about, less than 500 kids in a year being born in a county, or, maybe only 1 or 2 people taking a bus, you can't run a bus route. You can't have multiple pediatricians. You can't do the kinds of things that you need to do if those numbers are low.
Right.
And I think there's been a pattern established now over the last probably 5 or 10 years where people go outside of the county to get some of those services.
Right. Those who can get outside
Those
the
who
county.
can, that's exactly the point. And those who can't, suffer the consequences. And so these are difficult, complex issues. And I say this in all honesty. I've not met anybody who wants this to be the case, right? Everybody that I talk to, from county commissioners to, the person on the street, they say, We know we need better transportation. We know we need more supermarkets. We know we need more pediatricians and
Right.
OBGYN docs. But we don't have the numbers. And so that gets in the way.
So your foundation supports other organizations that are working towards a means to an end to these problems. So, for example, housing, transportation. Are any of the organizations working specifically on those problems? And if so, what is coming forward?
Well, we've made a significant investment over the years in our partnership with the Salem Department of Health, the county's Department of Health.
Mm-hmm.
They do great work there, and they're always stretched to their capacity. But they're responsible for SCOOT, the transportation. It's the acronym for the transportation system here in Salem, that picks up seniors and disabled people, gets them to medical appointments. It's a great service, but man, we could use twice as much SCOOT.
Right.
So we do invest each year in providing a match for the county to draw down state money, and it's a pretty significant amount of an investment. We are and have been for a number of years supporting scholarships for nursing students here in Salem County at the Salem Community College, and that's one of the best nursing programs in the state. So we're proud to be a supporter of that. We've supported Meals on Wheels. We are a frequent contributor to Habitat for Humanity. And we've invested in a number of community-based projects, sometimes just mini grants, smaller grants, but just enough to kind of keep them going.
Can you give me an example of that?
One of the grants that we made this past summer was in a soccer program. One of the churches in Carneys Point runs a soccer program for kids. It's a freebie. Kids get to come for, I think it's like 10 days or something.
Right.
It's a fun program, and it costs the kids almost nothing to attend. We made a small investment in that, wound up that they're able to get in a whole bunch of kids that participated.
Right.
And we do other kind of these smaller grants as a way to kind of supplement what happens in the community. Those we call our mini grants. Then we have other grants that are called matching grants, and that's just what it sounds like. If an agency or an organization is able to raise up to $20,000, we'll match that $20,000.
Okay.
And we have, this past year, we funded 10 of those. In 2025, we'll probably fund about 12 of those.
Okay.
That was for us in 2023. In 2024, for example, it'll be an investment of about $240,000.
Wow.
Yeah.
That's significant.
Yeah.
So since the foundation began in 2002, it has awarded nearly $59 million in grants and awards. Where does this funding source come from? Government, private donations?
No, the money was all part of the endowment that originally spun off from the hospital.
What was that initial endowment?
I don't remember, but at one point it grew to $60 million.
Okay.
Yeah. So the endowment is a little more than half of that now. And again, that's in large part because of the investment that the foundation made in keeping the Salem Hospital open.
Right.
That investment included a series of loans and grants. Unfortunately, the loans were not able to get paid back, and the grants were grants, so they weren't given back.
Right.
It was worth the investment of keeping the hospital open. However, it's kind of made us rethink what our priorities are, how we can better utilize the resources we have left.
And how do you decide those priorities? So I'm assuming the people will, you'll put out a call for applications, you'll get the applications. How do you prioritize?
Great question. We always use as the standard, we have an online application process. People fill that out. They'll sometimes call us. We frequently will go out and meet with them, or they'll, even if we do something virtual, but we want to talk with them about their application. Is the application consistent with our mission and vision? And we ask people before they do anything, before they, literally, punch the keystrokes on their computer to write an application, we ask them, have you read our mission, our vision, do you know something about the history of our other grantees?
Right.
Is the work that you want to do consistent with improving the health and well-being of people in Salem County?
Mm-hmm.
So that's the baseline. And
Right.
then I think we look for whether or not an organization has capacity. Does it have a history of doing this kind of work? Do they have a clear North Star about why they want to do the work? And do they have a staff that seems capable of pulling this off? Do they have a budget that supports the work beyond what our grant is?
Right.
Because our grant is usually just a portion of the...
Right. Do they have sustainability?
Yeah. So those are some of the factors that we use. We have some grantees that have been recipients for many years. And then we, in the time that I've been here now, we've tried to invest in some newer ideas and organizations that we think might be able to improve the outcomes.
Yeah.
For
How
kids
many
and
applications
families.
do you usually get per year?
It depends on the matching grant. Last year we had about 17
Okay.
for 10
10 spots.
10 spots.
Mm-hmm.
And we did a special project right now. It's been going now for about a year and a half or so. It's called Salem Smart Start for Parents and Children.
Okay.
And it's specifically aimed at improving the outcomes for the young parents and their young children. So there's a number of young women in this county who get pregnant, don't get prenatal care, have complications with their birthing process, and then kids 0 to 3 who don't get the right kind of, or don't have the opportunity maybe for early learning programs, daycare programs, et cetera.
Mm-hmm.
And so as we looked at that issue, we didn't find that there was a lack of services or supports, but what we found was there was no connection between and among all the services, right?
Right.
So what we did is we put out a request for application, and we said, we'd like to see if an agency could step forward and help to make sense of all of these different resources, put them together, and see if we can wind up at the end of that with better outcomes for the parents and better outcomes for their kids.
Mm-hmm. So
the agency that was awarded that grant, it's been a 2-part grant, both a planning and a planning grant and an implementation grant, was what used to be called the South Jersey Perinatal Cooperative. It's just now called the Cooperative.
Mm-hmm.
And they've done some really good work, including making young parents a part of the hiring process for doing their planning work.
Okay.
So some of those young parents were out there doing focus groups, doing some social media work, really helping to inform the work from the ground up.
It brings in ownership.
Totally.
They're not just getting the money, they're actually investing time.
You don't want a bunch of people looking like me, at my age and where I am in my life in terms of just my experiences. We want, young people who
Mm-hmm.
understand, what it's like to start a family in Salem County, and what they could do to improve their well-being.
So, what are some of the effective strategies that are used that healthcare providers could use to address these social determinants? How can what you guys are doing shift to the wider healthcare community?
Well, we're I think somewhat fortunate in Salem to have Inspira here. They really understand the complex and the complex nature of factors that influence people's health.
Mm-hmm.
They do a lot of good preventive work, really good community-based work. They're trying to go upstream to address issues before they occur, and also to be accessible, actually in the community.
Mm-hmm.
So Inspira is one example of that, but there are a couple of health clinics here, I think, in the county.
Right.
Our work really involves seeking out organizations and leaders in those organizations who see the big picture and who realize that if you have a family showing up every month for food, or if you have kids who are chronically ill, or you have kids showing up for school with not enough, they haven't eaten enough, or we have, a grantee right now with one of the schools that has a little care closet, right? And they provide kids with some food, with some soap, things that they can bring home,
Right.
Clothing, underwear. Those are the kinds of factors that influence the health and well-being of a family or an individual. So we're looking for leaders in those organizations that understand that big picture and who understand that the sooner that you intervene, the faster and the farther upstream that you go, the more likely you are to be successful in working with those families.
Right. So do you think that, healthcare policies can or should be adjusted overall? I mean, you've worked in government. Do you see that there is something at the governmental level that should be happening? And if so, what would that be?
Yeah, if I knew that, I don't know. Yeah,
You'd be on the cabinet.
Yeah, right. It's a really complex issue. I think we're trying to figure out from our little place in the world here what we can do, what difference we can make. But I will say this. Most of my work has been in urban environments, and to spend more time in a rural community has helped me understand a few things. One is that the size of a jurisdiction, makes a difference, right? Because
Right.
the fewer people you have, the less likely that you're going to have the right kind of resources.
Right.
So that matters. I think the second thing is that it's really critical to have healthcare providers who get the big picture and who have not just a bedside manner, but an understanding of the challenges that families, individuals, senior citizens face when they live in a community that is somewhat rural and can be isolating. I think the other thing is that it would be great if we can promote more preventive healthcare, which is something that unfortunately our system as a whole across the country, not just here in Salem, that we tend to wait too late before it's time to intervene. And at that point, we just give people a bunch of medications.
Right. So what would you consider the most critical social factors right now that contribute to the disparities in health?
Poverty, race, geography, and generational trauma. Great deal of untreated mental health issues and substance use.
And out of those, what do you think are the most critical issues to hit first?
I think they're all connected and way beyond the scope of any one organization or agency,
Right.
or foundation.
Which is why you support a wide variety of those.
Yeah.
So what methods do you use to evaluate the effectiveness or the success of the grantees?
This is the next wave of work for us. We've been a foundation that historically has tried to measure outcomes, not been as successful at it as we like. I'm not blaming anybody or faulting anyone for that. I think it's been difficult, in part because many of our organizations that we fund, excuse me, they literally don't have the capacity to do evaluations. And the grants that we give them aren't always the kind of the right size for us to do that.
Right.
But we've got to figure out a way to help those organizations build their capacity. So going into 2025, our board has approved the foundation spending more money on what we call capacity building. So we did a couple of things in 2024, which were big successes. For example, we did a virtual seminar on how to write a proposal. Only lasted about 2 hours, but we had over 100 people on that Zoom. We did an in-person session another virtual session on how to use data to measure your work. And we had, 40 or 50 people attend that. So we know there's a hunger for this kind of information. But when you have a nonprofit in Salem County that has maybe 3 or 4 people, working in it, or you have an organization that has 1 or 2 people who have an advanced degree, and no one else who really understands how to do evaluations, it's hard for us to make that demand on an organization.
Right.
So we're really trying to kind of pick apart what are the best ways that we can support our grantees in showing us real outcomes, not just what they did, not like the outputs, but the outcomes.
Right.
And the other thing is that we're looking at, and this is, just totally speculative, but we're considering, we've even put money aside for it for 2025, to create something like a children's report card. I would love to see us create something for Salem, and other counties and jurisdictions have done this over the years. This would not be a new idea on my part. But I've worked in other jurisdictions where they create essentially a document that highlights how well are kids doing in this county as it relates to poverty, abuse, and neglect, other factors that might influence their lives. And what implications does that have for how the county uses its resources? So we're talking with a couple of partners right now, some folks from a university and Advocates for Children of New Jersey and a couple of others, to think about how we can put together something like that for Salem County. And by the way, I'm not talking about a document or a report that would just be for, the eggheads like me.
Right.
I'm talking about something that anybody in Salem County could pick up and say, hey, look at this. This shows that we're not doing so good compared to some of the.
So you mentioned like a 1 to 100 scale, for example, that anybody who's ever gone to school can have a good idea of what a 70 is, what a 90 is, what a 50 is.
We have to figure out the ranking system. Again, other counties and other communities have done this, and so we could get some ideas from them. But the point is that it would be, I think, motivating for parents and for grandparents in Salem County to take a look at that report card once it's created, and to be able to say, here are some areas we think we need to do some work.
Right.
If we have poor prenatal care, or if we have, a noticeable lack of affordable daycare for kids, those are factors that might motivate people to get engaged and get involved and to work with their elected officials to do something. And by the way, I've had a couple of the county commissioners who've said we would love to, see where we are in relation to other counties as it relates to what happens for kids and families here. So there's a strong appetite. Doesn't matter if you're Democrat or Republican or where you are in the political spectrum.
Right.
Everybody in this county seems interested in strengthening families, and that's what our foundation is really trying to do, is how do we become an active partner in strengthening families.
Right. So, how do you envision the role of the foundation evolving in the next 5 to 10 years?
I'd like to think we're going to continue on this path that we're on. This is the next logical step from where the foundation has been for the past 20 years. And, we inherited a foundation, I did anyway, that had a strong reputation, history in the community. People, for the most part, who needed to know us did. But we also inherited a lot of opportunities to grow that work and to take it to its next level. So that's where we are now. We want to be able to settle in on a combination of grant-making practices that allow us to support those small projects like the summer soccer program,
right,
and maybe activity that happens at, a basketball camp, or Apple Farms, with some arts and recreational programs. We'd like to be able to support that, but then we'd also like to have 2 or 3 projects that are going to create some systemic improvement or change, right? So the big ones and the small ones both.
Right.
There's a place for that. And because there is not a lot of other philanthropic work in the community, like there's, this endowment's pretty significant.
Right.
We really feel like we have that responsibility to do that kind of work.
Very good.
Yeah.
Just real quick, just about you. What does Paul do during his free time?
Free time, I like to cook.
What do you cook?
Mostly Italian food, not surprising. Anything with carbs, actually.
Right, right.
And I get to the gym pretty regularly. And I like to read and write both. I do a lot of reading.
What are you reading?
Right now, I just started a book by David Brooks on how to know a person, I guess is the title of it. And then writing, I do a fair amount of writing for my field of child welfare profession, mostly editorials and opinion pieces for a couple of different newsletters.
And we're always looking for that as well.
Okay.
So we'll talk about that a little bit.
Great.
Paul DiLorenzo, thank you very much for being with us. We appreciate that. And thank you very much for watching. I am Dean Johnson for Follow South Jersey. This is Follow Salem Podcast. Thanks for watching.